Rahman Rahim. In this video, we will discuss the pathology of urinary system. Before we start talking about pathological lesion, pathological disease, pathological change, we should take a short note to remember the anatomical, histological, also physiological function of urinary system. Urinary system composed from kidney, ureter, bladder, and at last urethra. This four major component of urinary system divided into two main categories. First one called the upper urinary system part, also the remain parts called lower urinary system, upper and lower. This term, upper urinary system, lower urinary system, used mainly in indicate of infection. We called upper urinary system infection, lower urinary system infection, that help us in define the etiology of infection. The anatomical structure of kidney, as we mentioned before this slide, composed from kidney, ureter, bladder, and at last urethra. The anatomical location with this parts mainly located within pelvis cavity, also kidney within abdominal cavity. The location of the urinary system vary from species to species of animal, from male to female. As we see here, the urinary system of female, which is different in urethra fusing and urine protection, also location of the urinary bladder. So it is different from male to female. This is a picture for female horse and male horse. As we see, the main difference, which is urethra length. The urethra length in the female is very long compared with the length of urethra within female urinary system. Also, there is a main difference between the shape of kidney. The kidney of cattle, usually lobulated kidney, meanwhile the kidney of sheep, horse, dog, cat, look like human kidney. It has a bean shape. The histological structure of kidney contain mainly from a basic structure called nephron. This basic structure contains from glomerula, which is composed of a collection of small blood vessels, and we should remember the both efferent and afferent blood vessel from glomerula, which is artery. The glomerula, a collect of blood vessel, but it's mainly artery, not artery and vein. No, both of them, the internus one and the externus one, both of them, which is which is R3. This R3 then go to the tubule, and from the tubule become turn over to become a vein. This is important thing. So in pathological change, when there is disturbance in the blood flow within a glomerula, that of course leading to infarction to the blood vessel of all tubule, not just or not remain within the glomerula. Glomerulus and Bowman capsule play a big role in filtration of fluid from blood. Then histologically we have the descending loop of tubule, the loop of Hilli, and at last the ascending tubule and the main collecting duct, which is collect urine from many nephron or from many tubule. There's a tubule from here, tubule from here, tubule from here. All of them put urine to collecting duct. The filtration of blood occur within the glomerula. We now talk about physiological function. The filtration of blood occur with the glomerular Bowman capsule. All liquid, all water soluble material except the large molecule as albumin, all of soluble vitamin, minerals will take a leak from the blood vessel within a glomerula and take a leak to the collecting to the tubule. The descending and ascending tubule reabsorb this material from the filtered urine and then reconcentrate the urine before the urine travel to the collecting duct and export. Let's now to move to pathological change or pathological disease. As we learned before, we firstly talk about the developmental anomalies. Developmental anomalies of kidney, which is vary from species to species, but is mainly occur under the topic of aplasia. As we take before in the general pathology, aplasia mean hypo, which mean agenesis or absent of kidney. So, as we know, the one should have two kidneys, but sometimes there's absent of one of them, and I speak about human. He will have just one kidney. Also, it's occur in animals. Sometimes he has more than one kidney, more than two kidney. Maybe he have 3 kidneys within the same person. Aplasia means agenesis. Also, we have hypoplasia. Hypoplasia also occur within kidney. The hypoplasia usually occur due to genetic defect, and it is autosomal gene. Recessive lead to small size kidney, non-functional kidney also. The other more common anomalies before we talk about the common anomalies within kidney, in this picture we see some anomalies as divided kidney, pelvic kidney, when kidney descending to the lower part, supraneural gland, monokidney, also as we say before this slide, tri kidney, fused kidney. This type of congenital anomalies come with this special shape of kidney. Come with look like a horseshoe. It's also called horseshoe kidney. Two kidney fused from the cortex and become a kidney like horseshoe. Supernumerary kidney, an increase in the number of kidney, as we say. This is not for enter in the exam. More common congenital anomalies called cyst. The cyst, as the name refers, it is mean dilation of the pelvis, or maybe dilation with a nephron, dilation with cortex, or extra cyst attached to kidney. So the cysts classify into many types. Type 1 cyst, it's occurred due to dilation of collecting tubule. When the collecting tubule, as we said before this, there's a glomerula and collecting tube. The collecting tubule, this part of collecting tubule may be dilated. This dilation become observed by naked eye. This dilation and also this dilation filled with water. This dilation called type 1. Type 1 cyst formation. There is type 2 cyst formation. The picture here indicator to type 1 cyst formation. Type 2 is also called polycystic kidney. The kidney, as we see in this picture, have more than one cyst. This cyst originated from the collecting tubule absent. When the collecting tubule absent, that means glomerular capsule be dilated and filled with the fluid, sometime with blood from a glomeruli. Let's now begin talk about the part 1 of urinary system, the upper urinary system. As we mentioned before, upper urinary system contained from the kidney and ureter, and we will start with the kidney. The kidney suffer from a serious disease, a serious condition, a condition which maybe lead to death of animals. This condition called renal failure, kidney failure, or renal failure. This condition is very important. It goes to death if it is become severe. Also, it classifies based on the type of failure. The failure with the excretion of kidney, or failure with hemostasis of kidney. As we know from the physiology, the two main important function of kidney, which is excretion and hemostasis. Excretion occur within the glomeruli, and hemostasis occur within tubule. Also, the renal failure classification according to clinical manifestation. It is classified to acute renal failure and chronic renal failure. The acute renal failure usually occur due to a pre-renal cause. What we mean by pre-renal cause? Pre-renal cause, which is a defect occur not in kidney, but within heart, within the blood, due to hemorrhage, shock, bleeding, heart failure. This defect will be lead to acute renal failure. The chronic renal failure also the subtype. Chronic renal failure mainly occur due to renal cause. The destruction within renal parenchyma, within renal tissue. The destruction usually occur spontaneous or slowly and become chronic. The failure of kidney occur when there is fall of the function of kidney, or there is a reduce of functional nephron to third, or fall to quarter of functional nephron. What that mean? That mean when we lose a 3 part of 4 of nephron, or 2 part of 3 of nephron within kidney, when we lose this much of nephron, that will lead to failure appear. Let's start with the failure of excretion. Failure of excretion, it is mainly occur within the glomeruli, because the glomeruli is the main responsible for excretion. And what we say about this function, it's called glomerular filtration rate. When there is a reduce in the glomerular filtration rate, there is a disturbance of function of glomeruli, and fail of glomeruli lead to failure of excretion. The failure of glomeruli function lead to fail in waste product excretion, and the waste product become accumulate within the blood. Waste product as nitrogen, that lead to nitrogen and urea, that lead to urea alleviated within the plasma, also nitrogen alleviated, and the nitrogen when become alleviated lead to toxic effect on tissue and acidosis of blood due to disturbance of pH. Also dehydration will be occur, and the general failure in other system may be occur. The fail of glomerular filtration rate to maintenance the waste product, or to expel the waste product, lead to appear of azotemia. Azotemia mean alleviation of serum concentration with urea and creatinine. When the concentration of urea and creatinine alleviated within serum, this is called azotemia. Azotemia classified according to the site of the causative. Azotemia classified to peri-renal azotemia, or renal azotemia, at last post-renal azotemia. The pre-renal azotemia occur due to, as we mentioned before, heart failure, a blood problem, anemia, hemorrhage, shock, bleeding, all this goes to pre-renal azotemia. The renal azotemia occur when there is a specific infection or a specific disease or pathological change within the glomeruli. Sclerosis of glomeruli, glomerulitis, glomerulonephritis, sclerosis, all this will be lead to defect within the glomerular function, and azotemia appear here as renal azotemia. Also, we have the post-renal azotemia, which is occur mainly due to urolith, which is a stone that blockage the passage of urine through the renal pelvis or renal urethra. Also, we have clinical term called uremia, which is a clinical term, clinical syndrome. It's mean fail in the excretion and fail in the hemostasis, both of them. The second type of failure of hemostasis. The failure of hemostasis, which is occur with the tubule. As we speak before, the excretion failure mean glomerular failure. Hemostasis failure, which is mean tubule failure. Sometimes the glomeruli damage spontaneously combine with tubular damage. So failure on both types, it's commonly occur. The failure with hemostasis, we called it a failure in maintenance of hydration. As we explained in the second or third slide, we say there is excretion of all the fluid of body, the fluid with low molecular weight, the excretion of all these volume of fluid into tubule. It's followed by reabsorption of necessary material from tubule. The reabsorption of this material includes sodium, potassium, chloride, extra. This is important material for body, so it should reabsorb. When tubule fail to reabsorb this material, the renal failure occur. This material important for the pH of the plasma. The tubule mainly damage occurred because tubular epithelial cell has or have because tubular epithelium have a high or a high level of metabolic rate. So when it is suffer from infarction or toxin or any other noxious agent, it will be degenerative and necrotic usually. But this necrotic change within epithelium of a tubule, it can't be regenerated, because tubular of epithelium can be regenerated to produce a new cell to instead of the dead cell. So it is regeneratable. The destruction of tubular epithelium produce a large amount of urine, lead to produce a large amount of urine. So the much fluid animals take, all of the fluid will pass through kidney with no reabsorption. So the specific gravity of urine become equal to specific gravity of plasma, because the urine contain the same content of a plasma due to failure of reabsorption necessary material. So the specific gravity become equal to 1.008, and this phenomena called isothenuria. Isothenuria, which is mean the specific gravity of urine, equal to specific gravity of blood plasma. Now let's move to the next slide, on to the next subject. It's called renal disease. Renal disease, and as we see before, renal mainly contain glomeruli and tubule. So the disease also is mainly occur within glomeruli and the tubule. The glomerular disease, common one, called glomerulopathy. Glomerulopathy, destruction of glomeruli due to unknown cause. That's usually with no inflammatory cell response with the glomeruli, and the glomeruli become full in their function and lead to leakage of urine from blood, or leakage of high molecular weight material such as plasma protein, and there is a proteinuria become produced due to fail of glomeruli to filter the blood within the same range of molecular weight of molecule, and the protein become leakage from glomeruli and escape to the urine, and the proteinuria will be developed. There is a term called, important term called nephrotic syndrome. Nephrotic syndrome, where is a complete damage to glomeruli, and there is a severe glomerulopathy, there is a severe loss to the protein of the body, and the body become retain the fluid within interstitial tissue, and the edema developed in all the body. Tubular disease. The tubular disease, it's occur mainly due to, as we mentioned before, due to the toxic substance, due to infarction, hypovolemic of blood, the toxic material, usually due to drug use, also the lysis of RBC and muscle, the myoglobin, hemoglobin, which is a toxic and irritant material to the tubule. And as we mentioned before, the regenerative capacity of renal tubular epithelia, high capacity. The nephrotic syndrome, we talk about this phenomena, generalized edema. We talk about this phenomena in the chapter 4 or 5, hemodynamic system, in the general pathology. Now we will talk about the inflammation of the kidney. The glomerulopathy, as we say, no definitive causative agent. Now we will talk about the causative agent. We will talk about Nephritis. Nephritis occurs due to viral or bacterial disease. This is known causes. The unknown causes we called glomerulopathy. Now we talk about nephritis. Nephritis with knowing the cause of nephritis. And there's a many type of nephritis, like bilionephritis. In bilionephritis, usually the causative agent usually come from the extrinsic pathway from the urethra orifice, from the urethra through the bladder and ureter, ascending to the kidney, like Corynebacterial renale. Also, we have embolic suppurative nephritis, which is occur from hematogenic. Bilionephritis occur from extrinsic pathway, from extrinsic causative. The causative come from the orifice of urethra. In the embolic suppurative nephritis, the causative come from blood and they travel as a colony of bacteria lodged with the glomeruli and proliferate within the glomeruli and go suppurative nephritis, as we see in leptospirosis. Also, nephritis maybe come with granulomatous type in a chronic infection or in a chronic situation. There is granules separated within kidney parenchyma. There is a special type of inflammation which is occur within kidney. It's called hydronephrosis. The hydronephrosis, this type of inflammation occurs due to obstruction of tubule. When the tubule obstruct or renal flow obstruct in the pelvis and the collecting tubule due to inflammation or other thing, it will cause accumulation of the fluid within, accumulation of urine with a hollow chamber within kidney. The circulatory disturbance occur within kidney, mainly the infarction of kidney, and this type of infarction may be occur within all kidney if the obstruction occur on renal artery level, that will cause to infarct all the kidney. But when the obstruction occur within small vessel that may be supply a pyramid structure of kidney, this structure will be infarcted. Also, hemorrhage occur within kidney capsule as in Clostridium, and it's important to get the Clostridium sheep. The neoplasia, which is occur within kidney, may be primary. We mean by primary the neoplasia, which is neoplasia which is originated from the tissue of the kidney, from the glomeruli, from the tubule. And common neoplasia occur within animal, dog and cat. It's called nephroblastoma. Nephroblastoma with dog and cat. Also, lymphosarcoma occur, metastatic tumor, like as we say, lymphosarcoma occur as secondary type of neoplasia. The second part from the upper respiratory, upper urinary. The second part of upper urinary, which is ureter. Ureter transport the urine from the kidney to the bladder. This tube-like structure suffers from three things. Number one, congenital anomalies called ectopic ureter. Ectopic ureter, which is mean the ureter connects to the wrong side of the bladder. Ureter suffer from blockage of stone with it and lead to dilation of ureter in the site before the lodge location. Also, ureter suffer from urethritis, inflammation, as we see in pyelonephritis, when the bacteria travel through the ureter from the bladder to the kidney. Now we move to the second part of urinary system. Now we move to talk about the lower urinary system. Lower urinary system contains from the bladder and the urethra. And we are lucky because this part not contain a large thing or important thing. So let's start with with the bladder. The inflammation of bladder called cystitis. It is mainly occurred due to ascending bacteria from urethra, and as we mentioned, Granulomatous within cattle is main causes, also in the sheep, because the resistance structure of bladder. As we know, the urine accumulate within the bladder for short period, and they are expelled to the out of the body, and this continuous flow of urine through the ureter and through the bladder through the urethra, which prevent any proliferation of bacteria in this location, and that help to there is no much lesion occur within these three parts. All of these three parts carry urine and continuous flow of urine within it: ureter, bladder, and urethra. Due to migration of some parasite within a bladder, maybe there is a chronic cystitis occur. Also, there is acute cystitis, as we mentioned, in the bacterial infection. Also, viral infection may be developed from peritone travel to the bladder. Sometimes the structure of the bladder change due to severe inflammation and have a polyp like inflammatory structure, which is called polypoid cystitis. The uroliths. The uroliths mean stone. Uro from urinary. The urinary stone or urolith, it's mainly localized within a bladder. It's usually formed within kidney pelvis and then descending from the kidney, traveling through the ureter to become lodged with urinary bladder. And this stone may cause irritant to the wall of the bladder and induce chronic inflammation within it, and also maybe then it use transitional cell carcinoma within it. This urolith mainly contained due to the storvate, which means magnesium ammonium precipitate, which is come within urine from the kidney. Also, we mean also the stone may be formed within a bladder. There is a multifactorial help to stone formation within a bladder place. The urine pH, the much acidic or much alkaline urine help in stone formation. Reduce water intake and reduce volume of urine infusion through the day. Also the concentration of urine, when it is increased and the urine become much concentrated, that eventually help in precipitate of the salt as magnesium and ammonium, and develop to become a stone. This stone may be lodged, as we say, in the urethra and cause big problem with the urethra and cause urolithiasis. The urethra suffer from two problems. One of them, which is urolithiasis, blockage of urethra with stone descending from the kidney or descending from the blood, and this commonly occur with male, because men have long urethra opposite to female, which is have short urethra. Also urethra may be suffer from the urethral plug, which is maybe descending due to hemorrhage within the bladder. At last, and at the last part of the urinary system pathology, we love to talk about urinary sedimentation or urinary sediment. Urine analysis. The urine analysis done with a lab by centrifugation of urine to precipitate the component of urine, and this component of urine usually consists from the cast, cells, crystals, microorganism. The cast indicate to proteinaceous material cast, also sloughing of epithelial cell. The cells include the RPC, white BC, neoplastic cell also appear within urine, and all this indicator to a hemorrhage, to an inflammatory process, to indicate to neoplasia within urinary system. The crystal usually found within the urine. The calcium oxalate crystal usually occur, but there is a cystine crystal, which is a condition, pathological condition. Microorganism is mainly include the bacterial within urine. This picture summarize the sediment may be found with a general urine exam done within lab. The RBC cast, white B cast, any collect of group called cast, free presence of cell called cells. This is important indicator to there is to indicate any problem with urinary system. At last, I hope to finish my lecture with a summarized review of urinary system pathology. Thank you for listening.